Question 16. A 1-week-old premature neonate was brought to you, with the following signs and symptoms: blood in diarrhea, severe abdomen pain, distension, and doesn't stop crying. On auscultation, absent bowel sounds. The child was sent to surgery and a small portion of the small intestine was removed. Pathological studies revealed perforation of the resected tissue. What is expected to be seen on microscopy? A. Transmural necrosis. B. Diverticula. C. Thickened collagenous band. D. Inflammatory pseudopolyps. The correct answer is option A. Transmural necrosis. Transmural necrosis refers to the death of tissue that extends through the full thickness of the intestinal wall. Diverticula are pouch-like protrusions that can form in the walls of the intestines. But they are not typically associated with the sudden and severe presentation described here. While options C and D are findings often associated with inflammatory bowel diseases, like ulcerative colitis, which is rare in neonates and usually manifests later in life. Question 17. A 36-year-old man presented with a persistent burning sensation in his throat, indigestion, and heartburn. He states that these symptoms started 8 years ago, and the burning has gotten worse. Symptoms occur 30 minutes after eating and last for up to 3 hours. Antacids are no longer benefiting his symptoms. Tests for Helicobacter pylori are negative. The patient denies using any alcohol or smoking. This patient is at risk for developing which of the following? A. Adenocarcinoma of the esophagus. B. Gastric carcinoma. C. Krukenberg tumor. D. Gastrointestinal carcinoid tumor. Given the patient's history and risk factors, he is at risk for developing adenocarcinoma of the esophagus. Chronic gastroesophageal reflux disease leads to a condition known as Barrett's esophagus. Barrett's esophagus is a known precursor to adenocarcinoma of the esophagus. Options B, C, and D are not directly associated with the symptoms and history described. Question 18. A female, with a known case of bronchial asthma and allergic rhinitis, came with poor control despite taking inhaled steroids and oral steroids. She also takes aspirin and ibuprofen for a reason of joint pain. On examination, the doctor found nasal polyps and chest wheezing. What is the management? A. Stop aspirin and ibuprofen. B. Chest CT. C. Immunoglobulin E and eosinophil level. D. Direct view with a laryngoscope. The correct option is A. Stop aspirin and ibuprofen. Explanation. Presentation suggests a condition known as aspirin-exacerbated respiratory disease, AERD. Also referred to as Samter's triad. AERD is characterized by the triad of bronchial asthma, nasal polyps, and sensitivity to aspirin and other non-steroidal anti-inflammatory drugs such as ibuprofen. The management of AERD involves discontinuing the use of aspirin and non-steroidal anti-inflammatory drugs. Question 19. A 70-year-old male patient, previously diagnosed with hypertension, was brought to the emergency room by his son. The son reported that the patient's behavior had changed, and he is experiencing memory loss. Additionally, the patient has been engaging in confrontations with others in the street. What is the most probable diagnosis for this presentation? A. Frontotemporal dementia. B. Dementia with Lewy bodies. C. Parkinson's disease. D. Alzheimer's disease. The most likely diagnosis is frontotemporal dementia. It primarily affects the frontal and temporal lobes of the brain, leading to changes in personality, behavior, and language skills. It often presents with behavioral disturbances and changes in social conduct. Options B, C, and D can also involve cognitive and behavioral changes. But frontotemporal dementia is more strongly associated with marked changes in behavior, impulse control, and social interactions. Question 20. A 30-year-old woman is experiencing chronic pelvic pain characterized by burning and throbbing sensations. The pain worsens at night and after standing for extended periods. During a pelvic exam, vasocongestion, uterine enlargement, and tenderness are observed. A laparoscopy procedure confirms the presence of varicose veins in the pelvic sidewall and broad ligament. What is the likely diagnosis for this case? A. Pelvic congestion syndrome. B. Vulvar varices. C. Peritoneal endometriosis. D. Pelvic inflammatory disease. The correct option is A. Pelvic congestion syndrome. Explanation. The presence of pelvic pain, uterine enlargement, tenderness, and varicosities of the veins of the pelvic side wall and broad ligament observed during laparoscopy are consistent with the diagnosis of pelvic congestion syndrome. The dilation of pelvic veins and the resulting congestion can cause pain and discomfort. Vulvar varices typically involve visibly swollen veins in the vulva and perineal area, while peritoneal endometriosis may involve the growth of endometrial tissue outside the uterus but presents differently from the described symptoms. Option D is also less likely, as it typically involves fever, pelvic discomfort, and vaginal discharge. Question 21. A 48-year-old woman, who is overweight and has a history of type 2 diabetes mellitus, experiences repeated episodes of abdominal pain. She has been hospitalized 6 times in the past years for similar complaints. She reports that the pain occurs after eating, radiates to her back, and is accompanied by nausea and vomiting. Additionally, she has brown, velvety hyperpigmentation of the axillary skin. What is the likely diagnosis in this case? A. Gallbladder cancer. B. Duodenal ulcer. C. Cholecystolithiasis. D. Pancreatitis. The hyperpigmentation is known as acanthosis nigricans. It is often associated with insulin resistance and type 2 diabetes. It can be a clinical clue pointing to the underlying diabetes in this patient. So the correct answer is option D, pancreatitis. Other options are less likely given the specific details provided in the case. Question 22. A 17-year-old girl presented with anorexia nervosa and was admitted for initiating nutrition. Shortly after, her blood samples revealed hypophosphatemia, hypokalemia, and hypomagnesemia. What is the likely cause of these laboratory findings? A. Incorrect nutrition protocol. B. Incorrect testing. C. Refeeding syndrome. D. Gastritis. The correct option is C. Refeeding syndrome. Refeeding syndrome can occur when an individual with malnutrition, particularly severe anorexia nervosa, is started on aggressive nutritional rehabilitation. It is characterized by a rapid shift of electrolytes, especially phosphorus, potassium, and magnesium, from the extracellular fluid into the cells, as a response to increased insulin release stimulated by the intake of carbohydrates. Electrolyte disturbances seen are due to the sudden shift of these electrolytes into cells, leading to low serum levels,